Welcome back. With me right now is Dr. Hassan Badai. Did I pronounce that right?
Badai.
All right. And he is with a company called, well, first of all, a company that does several different things to help you out with your pain. Pacific Pain and Regenerative Medicine. Good to have you here today.
Thank you. Pleasure to be here.
Yeah, pleasure to have you. And we're going to talk about a few things. Let's first go over what type of therapies you do, what your business does in general. Then we'll get into more specifics.
Sure. Well, thank you for having me on. Well, my focus is basically physical medicine rehabilitation and pain management. So I'm double boarded in that aspect. And the way I look at it is that in the pain world, people come to see me not because specifically of pain, but because the pain gets in the way of people's quality of life. And so what the options are available have changed in the recent years, and want to expose that to the community and the people who would benefit from that. So in the orthopedic realm, I focus on a lot of musculoskeletal pain, and in this community, we see a lot of that. So I do think that we can provide that.
So would this be for the kind of services you offer both for long-term acute pain or for people who went out and played a round of golf and wrenched their back and everything in between?
Correct. Yeah, so I deal with a lot of variety of types of pain. So I mean, we're talking about spine-related pain or joint pain or chronic neurological pain and post-surgical, or as well as cancer pain as well. So I see a lot of different aspects of that. And what I try to tell people that, we have a multimodal treatment approach in my office, and we focus on a lot of therapies from conventional to the most interventional and very innovative regenerative medicine treatment techniques.
Okay, and the pain is in the news a lot right now. Actually, the ongoing opioid epidemic, which of course is been used for years and years and years.
Correct.
And as we know, overused to treat pain, but along with that, it's basically masking a problem.
That's
absolutely.
It
sounds like what you're trying to do is, let's not mask the problem, let's go after the problem, and let's get rid of it as best as we can.
That's absolutely correct. Opiates is a pandemic of a concern, and what I focus on is non-opiate therapies as much as I can. And what I do is, I'm not completely against the use of opiates. There is an indication for it. However, just like you stated, it's a masking and not going to the root of the problem. In my office, what I like to do is get to a very organized approach to musculoskeletal diagnosis and getting to the root of problems, whether it's nerve root inflammation or spine-related problems in the sense of stenosis or joint-related issues. So what we find is that interventional treatment in conjunction with therapy, physical therapy, in conjunction with patient education and mesenchymal stem cell therapy has been very effective in controlling patients' pain, allowing them to be very functional. And so, there's so many great treatment options that can reduce opiate intake through all of these modalities.
Okay, now speaking of stem cells, I think, years ago, not that long ago, when people first heard of stem cells, they were talking about the embryos and things like that. It all went through Congress and all that. This is different.
Yes.
In fact, stem cell therapy has been used quite often and to good results. Bone marrow is a classic example of that, right?
Yes. I mean, the whole stem cell subject is absolutely fascinating for me. I am very excited to use stem cell therapy in my practice. I'm getting fantastic results. And the understanding is that people don't have a really good understanding of what we're doing in terms of stem cell.
Right.
So I just describe a evolution of regenerative medicine, where we are today and where we came from. And so along the way, we understand that the body heals through its own natural inflammatory healing process.
Right.
And what we've discovered was that, well, prolotherapy was the first utilization of this regenerative process. And so that's just an irritant solution. And then what we learned going forward was PRP, which people are now understanding what that means. And that's a platelet-rich plasma. When that right there will secrete growth factors, which will bring stem cells.
Okay.
Now, stem cells then became the topic of discussion, and we started understanding where can we get the stem cells. So stem cells originally were easily obtained from the bone marrow and the fat tissue.
Okay.
Well, what's the concern there? Well, as you and I, we age, the quality and the viability of our stem cell will go down, right? So you can't compare a stem cell from an 80-year-old hip bone marrow or fat tissue to a 15 or 10-year-old and 5-year-old, right? So if we were to get it from an earlier source, the quality of that stem cell as we get older becomes a little bit dysfunctional. So what we've learned and used is that we can go all the way back to the first day of obtaining the stem cells legally, and that is the umbilical cord blood derived right at birth from a cesarean section, a healthy newborn. And so the transfer legally, we can grab those stem cells, process it, and cryopreserve or ship it to my office, and we could administer that stem cell into the joint or the spine, and that can effectively galvanize or start the healing process of your own stem cells. And that's what we're seeing really good results. And so using a bone marrow or a fat tissue is not even an option in my office, because it's the amount of treatments comparatively is significant, and why need 3 or 4 or 5 or 6 bone marrow derived stem cell treatments when you can get the same effective treatment with one delivery of stem cells.
And what is the prognosis when you're using this? And along with that, is it always successful? What are some of the patient questions they should have? I was telling you earlier, I read a report from the FDA saying, here's certain things you need to look for and ask. We should do that for any kind of procedure. I don't care what it is.
Sure. So great question. So currently, we want to make sure that we're compliant with how we're delivering. So, and the quality and the tissue has to be within the FDA guidelines of the usage, right? So minimally manipulated, meaning we don't use a product and grow it on a petri dish or anything like that. But it's considered technically not FDA approved, investigational and experimental. However, we're getting fantastic results, and we are seeing more and more outcomes that are very effective. So we're very compliant with any and all regulations that are coming out. But it is absolutely used for musculoskeletal joint sport-related pain, and we are using that in conjunction with the therapies, the bracing. We try to incorporate non-opiate management. I do a lot of nerve blocks in conjunction with joint treatment to alleviate pain from the sensory component. So there's a lot of things that we do, and all together, we're bringing people's pain scores down, and that's the excitement of what we're doing. And all together, we're bringing opiate consumption down, and I'm documenting that in my office. I'm seeing a lot of that.
All right, very good. Their website is pacificpainfree.com. And by the way, when you go there, you put that in, it immediately comes up with your name. You got the right website. But if you look at the top line, you got to connect us there. But you'll know you're in the right place, because you will see this logo behind me on the screen, Pacific Pain and Regenerative Medicine. Where are you located?
I'm actually at the Hogue office campus, which is Sand Canyon and Alton, 16405 Suite 215.
Okay, right down the road there. Right there. Hope to have you back again.
Thank you. Thank you for having me.
Good to have you.
Absolutely.
We'll be right back.
Yeah.
That's good. You did a